Melissa Fraudette. Welcome to the committee.
Madam Chair, my name is Adam Karlan. I'm the Chief Nursing Officer at M Health Fairview Southdale Hospital. I've been a registered nurse for 15 years, including 9 years in varying leadership roles. I'm proud to be a nurse leader, and I'm grateful for the opportunity to represent my colleagues today. To put it simply, I have grave concerns with Section 5 of the bill, which authorizes hospital nurses to unilaterally refuse, with impunity, to accept a patient. This provision has the potential to confine some of our most vulnerable patients, including those experiencing mental health crises, to our extremely busy emergency departments. This bill creates significant opportunity for individual bias to determine who receives care in our hospital, bias to which our nursing profession is not immune. On a personal level, as a member of the LGBTQ+ community, I am deeply concerned how this bias refusal could impact my care. High-quality care requires a team. Teams that work around the clock to create safe working environments for our patients and their colleagues. Teams that work to determine the best location for patients under our care. This includes elective procedures, and to be clear, elective procedures would include things such as cancer surgery, open heart surgery, anything scheduled in advance. This means doctors, advanced practice nurses, therapists, and other members of the team working together in a delicate balance to properly care for patients. The legal sanction of patient refusal for one role within the broader healthcare team disrupts this delicate balance. It recklessly endangers patients and would significantly limit our ability to ensure reliable access to hospital care for all patients. Of concern, the authors of this bill have used the term retaliation to describe professional nursing accountability with respect to patient refusal. Minnesota already has strong whistleblower legislation with important protections for individuals who, in good faith, report situations in which the quality of healthcare services is in question. This law protects nurses that speak up. There is no substantive proof that there is widespread nurses who are raising legitimate patient concerns who are facing retribution from their employers. In fact, at Fairview, our safety always culture requires staff who have questions or concerns to speak up, to practice a questioning attitude, and to communicate clearly when there are issues. Authors of this bill have mistakenly confused retaliation for accountability. And in the case of Section 5, which gives nurses unilateral authority to refuse patients, this lack of accountability will create serious problems. It's important to consider the impact of this proposed provision will have on our underserved, marginalized, and vulnerable patients, patients that we care for in our hospitals every day. It is not a bridge too far to see this provision to be used to the extreme, giving people with conscious or unconscious bias the ability to pick or choose their patients, or further, clearing the way for mandatory staffing ratios through sanctioned patient refusal. We have existing whistleblower laws. We have existing internal processes and protocols to support safe care environments in our hospitals.
I have to ask you to wrap up, please.
We will continue to oppose this provision. Thank you.
Thank you.